Lance Consultants. In this video clip we're going to discuss common setups that you'll need to be familiar with in order to adjust your Vector 1 hand CPM for different digit motions. Looking at the machine here distally, we're looking at the spring on digit number 2, and typically our factory setting when a device arrives is going to look like this spring on the index. If you look behind the spring on the index at the long finger and the others, you're going to notice that those springs are more curled. So to achieve a good composite fist, what you'll need to do is remove your finger plate and aggressively bend that spring so it's in a tighter arc, which will allow each joint on the digit to articulate well for a full composite. The next thing we're going to discuss is the axis of motion. It's very important when you're trying to achieve a composite fist to make sure the axis of motion on the machine, which is here, is pointing through the MPs. The axis of motion can also be proximal to the MPs, which will allow a good composite fist. If we look at the dorsum of my machine and we see the black dot right in front of the dorsal hand plate, that does represent where my MP joint is. So if your MP is 1/4 to 1/2 of an inch in front of your dorsal hand plate, you will achieve a good composite fist. Next thing we're going to address is how to influence MP flexion. We can influence MP flexion 2 different ways. One, we can take our finger spring and move it to where the finger plate is now at P1, which will allow good MP flexion of the index. Or if there's a clinical situation where the clinician or physician still wants to address all 3 joints in the digit, perhaps because of edema management, but they want to make sure that they achieve good MP flexion, you can flatten the arc on the spring, which will allow articulation of all 3 joints, however influencing more MP flexion of digit number 2. Lastly, we're going to talk about how we can achieve better IP flexion or an intrinsic stretch with the device. And what that will entail is moving where our axis of motion is on the device. Currently, as we spoke about, it is through the MP joint. If we want to achieve a better intrinsic type stretch, we're actually going to bring the hand more proximal in the device, therefore moving the axis of motion more distal in the device. So the hand goes more proximal and the axis of motion goes more distal. So now my axis of motion is here through the PIP joint, and what that will do is it will increase the intrinsic stretch capabilities of the machine. It will influence better IP motion. If you look closely, you'll notice that when you move your axis of motion more distally on the hand, you're going to lose MP flexion, but you'll gain PIP and DIP motion. Another common challenge you'll face in the field is when you have the patient's hand in the glove, and during the flexion and extension process of the machine, the small finger tries to drift out of the finger sock. So if we look at this finger sock here, we're going to notice that the tip of the small finger is not in the very distal end of the finger sock. The way we can correct that issue is we can actually have the patient remove their hand from the glove. We can take a pair of scissors and we can cut all the way down the glove longitudinally, which therefore would separate the small finger sock from the remainder of the finger socks, and then we would pull this finger sock more proximal as identified by this arrow. What that would essentially do then is lower the small finger sock more proximal so the tip of the finger would stay well seated in the glove itself. Additionally, if you have a finger that is edematous towards the base, and we want to encourage edema reduction in the digit as well as make the finger sock easier to apply, we can do our most standard cut, which is called a tab cut. By taking a pair of scissors and making a cut in the finger sock at the base on the medial and the lateral side of the finger sock, this small tab will flip up, which will allow the patient to grab that tab and pull the finger sock down easier during donning and doffing of the actual device. If you have someone who has a situation where they are getting irritated by a finger sock and you need to create some space, we can actually do what we call a half moon cut to create more space for the base of the finger, and then we can even add a tab cut on top of that in order for them to have that small lever where they can pull the finger sock on more readily. What we're going to address now is migration of the device. If your patient has stiff MPs or stiff hand in general, the machine will actually try and slide distally as it goes into flexion. So your axis of motion, which should be through the MPs if you're going for a composite fist, will try and slide forward in this fashion. In order to eliminate that motion, we can apply an elbow X strap. How we would go about doing that is taking a piece of 2-inch wide strapping, sticking it on the inside piece of Velcro between the D-rings, go on the outside of the arm, across the back of the tricep, over the top of the device, and then back on the piece of Velcro between the D-rings. What that does is it leverages the device to stay seated so the axis of motion stays through the MPs, which will reduce migration.